Hi, good morning. I am Cami Pagar. As I said, I am the Community Impact Coordinator of Health here at United Way. I work with our STRIDE school-based mental health program, our Alcohol and Other Drug Coalition, and our Healthy Door County Coalition. And my co-presenter today is Melissa. Melissa, do you want to introduce yourself?
I sure do. As soon as I find that unmute button, I should have it memorized by now, you'd think. I'm Melissa Andrews. I'm the mental health navigator for the STRIDE program, working with our five local school districts to provide mental health services to our youth in Door County.
Okay, so we are here today to talk about mental health and substance use and what we are doing with our coalitions in this county. So to start out, we just wanted to give you some information about where we're at nationally and in Wisconsin regarding those two topics. So clearly 1 in 5 US adults experience mental illness each year, and that equates to 51.5 million people nationally. 1 in 20 US adults experience serious mental illness, and that is 13.1 million US adults. And then 1 in 6 US youth aged 6 to 17 have a mental health disorder. That's 7.7 million youth. And then suicide is the second leading cause of death among people 10 to 34, which is quite staggering to me. All right, so where is Wisconsin compared to all the other states? The overall national ranking, we are 19. So that means that 18 states are a little bit better ranking than us. Let me find my notes here. So the Mental Health America uses 15 different data points to judge the overall state of mental health rankings, such as adults with mental illness, adults with substance use disorder in the past year, or mental health workforce availability, among many others. So 19, you think, isn't that bad. We're doing better than half the United States. But if you look there at the mental illness prevalence, we are ranked 39th. That means 38 states are doing better than us when it comes to mental illness prevalence. Our adult rankings, we rank 24th. And our youth rankings, we are 15th. So we can do better.
All right. Excuse me, we can do better. And in our effort to do so, we looked at our stats for the youth in Door County. The lack of providers, in addition to our diverse geography, as you can imagine, is a unique challenge for a lot of people that live here. So in the state of Wisconsin, the mental health provider rate is 1 provider for every 490 people. And in Door County, that rate is 1 provider for every 730 people, which obviously is a huge concern for us and a barrier that we have been working to overcome. In doing that, we created the STRIDE program sorry, I'm ahead of myself, Cami, or you.
That's okay. Okay, so let's talk a little bit about mental health and substance misuse. So a co-occurring disorder happens when a person experiences mental health and substance use at the same time. 9.5 million US adults experienced both in 2019. As you can see here by this chart, there's definitely a strong correlation between the two. The serious mental illness with substance use disorder is over 25% in 2018, and then the serious substance use disorder with a serious mental illness is also over 15%. Which you have to remember, somebody who has a mental illness does not always have a substance use disorder, and vice versa. That is why there's a difference in that graph. Okay, so substance use for Wisconsin, 16% of adults are current smokers. That is right on par with the national average at 15%. But when it comes to alcohol, 24% of adults report they binge or drink heavily, and nationally the average is 19%. So we are a little higher, but when it comes to our culture, we kind of know that in Wisconsin. And in the past few years, we've known that opioids have become a serious problem. In 2018, 78% of the overdose deaths have been opioid involved. Okay, so substance use with our youth in Door County, vaping has been shown to be very prevalent the past few years. According to our YRBS, the 17% of high school students in Door County have vaped in the past 30 days, and 38% have tried vaping. And you can see kind of the trends here when it comes to the grade. Okay, when it comes to alcohol, 30% of high school students have drank alcohol in the past 30 days, and 60% of high school students have tried alcohol. Okay, so what are we doing about this here in our county? What are our coalitions and how are we helping this problem?
So a group of wonderful individuals in our community worked and came together and we launched our STRIDE program in the 2018-2019 school year. So as you can see on this slide, STRIDE does stand for Strengthening Trust and Resilience, Instilling Independence, and Discovering Empowerment. In short, we work with all 5 school districts to bring a school-based mental health program. So we started in 2018, and we had providers in all of our schools except for Sturgeon Bay Elementary in Washington Island. And so we worked to bring those together and got those on board by the following school year or late in that first school year. Essentially, we have all of our public schools have a mental health partner. So we work with local partners in our own community, Bellin, Door County Medical Center, Counseling Associates, and Department of Health and Human Services. I still want to call it community programs most days, for those of you who might remember it called that. So we partnered with those. And then as you can imagine, having tapped all those resources in our community, we did have to get a little bit creative when it came to finding a provider for Washington Island. Not all providers see individual or work with kids that are under the age of 12. So we also had to look further to seek out some providers so that we could have providers in our multiple elementary schools for Sturgeon Bay. So in doing so, we were able to that first year start out, and we had providers 1 day a week in the schools. The goal was to have 1 full day. Some were only half day in the beginning, but I am very proud to say that now we have providers in all of our schools, and we've even expanded that to multiple days in the school and being able to provide that support to as many youth as possible. In addition to that, not only providing that direct one-on-one counseling, but also providing resources to the staff at schools, providing trainings. We've had to shift that focus, obviously, in the last school year. That has changed a little bit as priorities and focus shifts in their own environments, but providing them resources and letting them know that they have people supporting them outside of their actual work environments as well.
Okay, so in addition to our traditional STRIDE, we had started a STRIDE Creative, which is about a year old. We had started working with a certified art therapist, Jody Gonzalez, in the spring of 2020. And originally we had planned for her to go in schools to offer one-on-one art therapy with students. Then the pandemic hit. So she was just getting started meeting with students when the pandemic hit and we all had to go home. So we utilized her over the summer to create videos to help with resiliency and self-care that we wanted to share to the public, and those can all be found on our United Way YouTube page if you want to go back and look at them. And then over the summer, we regrouped and really figured out how we could utilize her to reach as many students as possible for this 2020 to 2021 school year. And we decided to go with small group after school creative therapy sessions. These students are referred to by parents or counselors, and they are small groups, so there's between like 2 to 5 in each group. We are running these sessions for, well, the first session in the fall was for 9 weeks. We are just finishing up our second session, that was 7 weeks. And then we are going to offer our third session in the spring. With our Stride Creative, we did build a website to make it easier for these students to get referred and registered for this Mighty Teen program. And I do want to take a second to show you the website, if this works. Okay, it works. So you can go on this, it's stridecreativedc.com. We put a lot of resources on it, so it's not just for the Referred Mighty Teens program. It kind of explains what Stride is, our Stride Creative, our Mighty Teen program. And then it has resources for, you know, stress, things, anxiety, resiliency. Nobody can see it?
No.
Oh, bummer. Okay, let me try this. Maybe if I stop screen sharing.
Yeah.
Can you see it now? Okay, so this is our website. As I said, anybody can go on there and take a look. It's stridecreativedc.com. The Mighty Teens tab here is where parents can go on and register their kids for that small group Mighty Teen after school program. The About tab has a lot of additional information, and I just wanted to point out on this Getting Help, you will find the crisis hotlines, you will find the Door County Mental Health Resource Guide, and some additional information. But besides the Mighty Teen program, what we also did was work with Jody to create a 9-week self-paced program that anybody can go on and register for. It takes you through 9 weeks of videos that leads you in self-resiliency and kind of self-care activities. Let's see, I guess I'm gonna have to, now I'll just show you. So you go to the Clubhouse and you have to register yourself up for that. I am already registered. And then as you can see here, it takes you through each week. And it has videos. So a lot of our mental health providers sometimes use this to work with their kids. But if you're an adult and you need to do that also, you can. So that is Jody. They're very interesting, they're very fun, and they're very relaxing. Okay. Let's wonder if there's a better way to do this. Okay. So our Stride Creative Mighty Teen program, the first cycle in the fall of 2020, we had 23 students that got referred. And then in our second cycle that went from January to, this is our last week of that, there was 26 students registered. Our next cycle will be starting in the beginning of April, and the referrals go until March 31st. So that is where we are at with our Stride Creative program. Okay. Melissa and I were able to participate in a fun idea that came about at our Door County Mental Wellness Group. In July, we were able to talk with school administration and counselors about what they were going to need for this next school year when it came to resources and tools. And one idea that popped up was providing students with a mental health kit that they could use to relieve stress or have resources that they needed. We were able to find a grant for putting out a trial of 400 kits through the WISE Summer Meal Program. These kits included included calm down jars, 2 different types of journals, fidget toys, thinking putty, and some instructions. And then with the help of human resources and this, I think it was a CCS, I believe, we were able to fund mental wellness, mental wellness kits for all elementary school students in November. So we totaled 1,437 kits for every elementary student in November to utilize. Melissa, do you want to talk about the feelings thermometer?
Yeah, so in conjunction with that, around that same time, we received an email from the state saying that Governor Evers' wife had released this feelings thermometer and that we were able to request up to 10 if we would like. I received that email on a Friday and promptly sent one saying, I'm going to want more than 10, but I'll take 10. And by Monday AM, they were like, yeah, so we had an overwhelming response to that. So they actually were kind enough to share their print file with us. So we were able to take that print file and then work with FLS banners. So giving back to our local community as well by helping our local small businesses. We were able to work with them and print off. So we reached out to every school district and just said, we have the ability to provide these, and in what capacity would your school like to include it? So some requested it for all their students and all their staff. Others just had it for their elementary kids. Some, did actual lessons in the classroom with them. It was really cool to see what different, ideas people came about. But essentially it is, a 5x7 like magnet that you can put on your fridge or your cabinet next to your desk if you need it there. But essentially, as you can see, it kind of goes through feelings from low to high and what we can do about that. And so we were able to distribute those around the same time with the mental wellness kits. And just to continue that message that, we all need those helpful reminders sometimes.
Okay. A recent project that we've been working on with the Door County Mental Wellness Group, our AOD Coalition and our STRIDE Coalition, has been a suicide prevention campaign. It kind of came about at the end of 2020 when we had a couple of recent suicides. We really wanted to do something for the community and spread a positive message. So we started this idea of spreading a beacon of hope and being the light message, and just kind of a messaging that you aren't alone. We came up with lighthouse displays that spread that message. We worked with our P180 peer groups to paint and decorate them. Oh, and the YCC. So our kids had done a fabulous job creating all these lighthouses. We had 12 5-foot lighthouses, these larger ones that had stands, and probably about 40 little 1-foot lighthouses. We were able to get all the 12-foot lighthouses displayed at the Piggly Wiggly, the Red Geranium, the Boys and Girls Club, just kind of all around the county. And we're still working on getting all the small ones displayed. So if anybody knows of any place that would take a 1-foot lighthouse, let me know. But we are also going to start posting some videos on social media explaining how you can be a beacon of hope and really spread that light and positive messaging. So that is kind of cool, and that is something we're working on now. So our AOD Coalition, we have a couple of things that we are doing. Last year, we had applied for an SOR grant. That's a state opioid response grant, which we received. We were able to purchase medication lock boxes, medication deactivation envelopes, and medication return envelopes. This year, we put in another grant for that. We haven't found out if we were awarded it or not, but we are quite optimistic. So we'll be getting some more lock boxes and traveling lock bags to distribute in our county, along with some education about how to keep your medication safe. We do have our hidden in plain sight backpack that educates parents and teachers and professionals about what tools students can be using to hide all their paraphernalia that they should not be having. As you can imagine, this past year, that has kind of been on a little bit of a hold, but we are optimistic with getting those back back out there this summer and this fall presenting at schools for teachers and the parents. So our youth activities at our Door County mental wellness meetings and our AOD meetings, we had really discussed how we need to be offering our youth an outlet where they can socialize and go somewhere and be entertained. With this pandemic, they haven't been able to do that as much as normal. So we are going to start game nights for them virtually. I am working with Allie Brettel right now from DCMC, and we are planning our first game night at the end of March. We are going to have some fun little activities and prizes. We are hoping to have at least 1 or 2 every month through the rest of the school year, and then we can reevaluate and do the summer and fall. So that is basically all we have for you. I know most of you know, but the